Hey guys, this is Nursing School Made Easy, and today's lecture is going to be on hyperthyroidism. Now, in hyperthyroidism, you're going to have a hyperactive thyroid gland. Now, that's just the most basic way to think about it. Again, a hyperactive thyroid gland. And this thyroid gland is going to secrete thyroid hormones. And the ones that we want to focus on are T3 and T4. Now, the thyroid hormones are very, very important because these control your metabolism. So if you have an excess amount of T3 and T4, you're going to go into a hypermetabolic state. I want you to think about hyperthyroidism, and every time you think about hyperthyroidism, I want you to think to that little cartoon character, what was his name? Tasmanian Devil, Taz. Now that guy was just super hyperactive, just constantly running, spinning. So anytime you think about hyperthyroidism, think about that character. Or if you have another character in mind, just think of somebody who is extremely hyperactive, always moving, always jumping, always running. Get that into your head, because again, with hyperthyroidism, you have a hypermetabolic state. Now, the problem with hyperthyroidism is you have the potential of getting into something called thyrotoxicosis, or a thyroid storm. And again, in thyrotoxicosis or a thyroid storm, you're worried about entering a hypermetabolic state, always running, always moving constantly. And we'll get into why that is a dangerous or extremely serious medical problem. Okay, so one of the things that we need to focus on are what causes hyperthyroidism. So let's jump right into it. The things that you really want to focus on for the NCLEX exam is number one, Graves' disease. Now, let's look at a little bit of our anatomy here. And again, I'm going to oversimplify things. So this is going to be the head, and in your neck region, you're going to have your trachea. And wrapped around that trachea, you're going to have your thyroid gland. You have to know a little bit of your anatomy, because if you're going to go and assess your patient, if you're going to go and try to palpate the thyroid gland, well, you have to know where it's at, first of all. So it lies in front of your neck, in front of your throat. Okay, again, around your trachea. So if you're going to palpate, you're going to palpate the front of the neck, throat region. Okay. Now, this is also very important because if there's any surgery, if there is any enlargement the thyroid gland, it can cause some occlusion, because again, you're going to breathe in, air goes in through your trachea into your lungs. So if there's an occlusion here, well, that's going to have an effect on the amount of air that you breathe in. Okay, so again, it's very important that you know where your thyroid gland is. Well, anyway, let's focus on Graves' disease. Now, Graves' disease is an autoimmune disease. Okay, so this means that your own immune system is attacking your thyroid gland. Now I want you to think about this. Think about you punching a punching bag. Okay? And I want you to now think about your own immune system, your own little soldiers in your body coming here to your thyroid gland and just punching it. Pow, 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 pow. Just beating your thyroid gland up. Again, they're just punching the crap out of this thyroid gland. Again, your own immune system is doing this. It's attacking your thyroid gland. Now, as your immune system attacks or punches your thyroid gland, thyroid hormones, T3 and T4, will be secreted, will be released. Okay, so that's what pretty much Graves' disease is. Now, another cause for this hyperthyroidism is just an enlargement of your thyroid gland. So this gets larger. Again, same thing, more T3 and T4 is being released. And you may actually see an enlargement in the throat region that maybe you will be able to palpate. And if you auscultate, you may actually even hear a couple of bruits. Okay? Now, again, we're going to focus on Graves' disease. And again, in hyperthyroidism, you're going to enter a hypermetabolic state. You're going to have increased T3, increased T4. So let's get into a little bit of our signs and symptoms here. Again, the focus in hyperthyroidism is increased T3 and T4, and that'll come into play here shortly. Now, again, with increased in thyroid hormones, T3 and T4, you're going to enter a hypermetabolic state. I'm just saying that constantly so that it gets stuck into your brain. So let's focus in on our signs and symptoms. Number one, if you were to, again, auscultate the thyroid gland in an enlarged state, in an enlarged thyroid gland, you may actually listen to some bruits. Number two, if you were to palpate, you feel a large thyroid gland, large mass. And you may even actually visually see just a large mass in the neck region and the throat region. Now, some of these patients suffer from something called exothalamus. And what this is a protrusion of the eyes. Google that so you can see what this actually looks like, and make sure you know this for the NCLEX exam because you will most likely see this, okay? Again, exothalamus, that is very, very specific to hyperthyroidism. You will also see some clubbing and swelling of the fingers. Okay, so a lot of clubbing and swelling of the fingers, and that is something called acrophagy. Get my spelling here a little bit better. Acrophagy. Make sure you know that for the NCLEX exam. Again, that is clubbing and swelling of the fingers. Now again, going back to that little Tasmanian devil cartoon character, that guy's always moving, spinning, just all over the place. Now again, we're talking about a hypermetabolic state. These patients are always going to be moving around, walking, pacing, just extremely agitated. So because they're always moving, they're always very extremely hyperactive, they will have weight loss. Now again, T3, T4 will have an effect on the heart. They will make the heart just pump, 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 beat faster. So you're always concerned with their heart rate, because a lot of these patients will actually have heart palpitations. Because again, the heart is just very, 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 very hyperactive. So these patients may also have tremors. Again, they will be agitated. Their heart rate, their pulse, is going to be very rapid. Now, because of that, you always worry about atrial fibrillation. Very important. Now, a couple other things that you may see on your NCLEX are something like palmar erythema, redness, the palms of the hand. Make sure you know for that. Make sure you know this for the NCLEX exam again. Palmar erythema, very specific to hyperthyroidism. Let's see, what number are we on? 12. Very fine and silky hair. Again, these patients are always moving, constantly moving, very, very, very active. So these patients most likely be sweating. Their temperature is going to go up. If you're always running, if you're in the gym, pumping, doing push-ups, jumping jacks, running a mile, sprinting, what's going to happen? Well, you're going to begin to sweat, right? Now you sweat because you have increased body temp. So these patients will also have an increased body temperature, and you always worry about heat intolerance here. Now this is a bit of a misnomer, I think, but many books talk about heat intolerance, and reason being is, again, these patients are always moving, so you always run the risk of, again, constant motion, their temperature getting up really, really high. So you always want to put these patients in cold temperatures so that you can keep that body temperature down. Again, these guys are always moving. Something else that is also moving is their GI tract. So in these patients, you always worry about something like diarrhea and losing large amounts of fluids. The reason you have diarrhea is because you have increased, again, gastric motility. So with these patients, they will have increased or hyperactive bowel sounds. Anything they eat, their bowel is just going to be moving very, very fast, pushing it out of their body. So again, that is why you would have diarrhea. And if you have diarrhea, you can have a lot of water or fluid and electrolyte loss. So later on, we're already thinking ahead. If you're having a lot of fluid and electrolyte loss, you're always going to want to replenish those fluids. Okay, now we're going to get into that later with our interventions. Now again, these guys are always on the move, so their speech is very rapid. Again, hyperactive. They're always moving. Their mind is going a mile a minute, so they have difficulty with concentration. Again, these guys are always moving. You're going to have insomnia. You're going to be restless. Okay. Now let's focus on some diagnostic studies. The two things that you need to know for the nclex are: one, decreased TSH levels, and two, increased free T4. Now, again, a little bit of physiology here. Here's your head, trachea, and then right on top of your trachea or around your trachea, you're going to have your thyroid gland. Okay, so here is our thyroid gland. Now, in your head, you're going to have something called your pituitary gland. Your pituitary gland is going to secrete TSH, thyroid stimulating hormone. And just like the name implies, a thyroid stimulating hormone is going to come down and stimulate your thyroid gland to produce T3 and T4. Now, think about the example that I gave you earlier. Your own immune system is just punching the crap out of your thyroid gland. Pop, 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 pop. And as a result, your thyroid gland is secreting T3 and T4. And again, the one that we want to focus on is free T4. Okay, so your own immune system, especially like in Graves' disease, your own immune system is attacking your thyroid gland, and as a result, you are producing T4 in large amounts. Now, we talked about how your pituitary gland is going to secrete thyroid stimulating hormone. Well, the pituitary gland is going to secrete thyroid stimulating hormone only if your body requires it. If your body does not require it, your pituitary gland will not secrete thyroid stimulating hormone. So right there, that is very important for you to know, for you to understand. In this case, Again, your own immune system is attacking your thyroid gland. As a result, you are producing or secreting large amounts of T4, which is the one that we want to focus on. Now, because of that, because your body is already secreting, or your thyroid gland is secreting large amounts of T4, your pituitary gland is saying, whoa, 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 stop producing TSH, stop releasing TSH. Okay, again, your pituitary gland is going to say, whoa, there's way too much T3, way too much T4 in the body. Stop secreting TSH. Therefore, if you were to draw up some lab work, you would notice that you have decreased TSH levels in your bloodstream, okay? So that is why you would have decreased TSH levels. But again, your own immune system, for example, in Graves' disease, is causing your own thyroid gland to secrete T4. So those levels are going to be increased. And that is why you would have increased levels of free T4. Make sure you know that for the nclex. So that is the two, those are the two things you need to know for diagnostic studies, okay? Now, let's move into interventions. Now I'm going to clump therapy and interventions together, and it'll hopefully tie in for you. Again, just to say this again, in hyperthyroidism, your body is producing large amounts of T3 and T4. So therapy, treatments, they're geared towards lowering the amount of T3 and T4 in your body. If you're producing too much, well, again, the hope of therapy is to bring those levels back down to a normal level. So you can do this by a couple of different mechanisms. Number one, you can give anti-thyroid drugs. And again, the hope is to bring those T3, T4 levels back down. So again, you would give anti-thyroid drugs. So something that you can give is PTU. Make sure you know this, PTU. PTU stands for propylthiouracil. Okay, PTU, propylthiouracil. Now this treatment may be given for 6 to 15 months. Now again, you're giving this in hopes of bringing T3 and T4 levels back down to normal states or normal levels. So again, number one was PTU, propylthiouracil. Another thing that you can give is something called Tapazole. Same effect to bring T3 and T4 levels down. You can also give large amounts of iodine. Again, large amounts of iodine may be given. Now, if you're going to give large amounts of iodine, make sure you mix this with water or juice. Make sure you give the patient a straw. And make sure you give the iodine after meals. Now, if you're going to give large amounts of iodine, you want to make sure that you assess your patient for nausea and vomiting, for skin reactions, as that may be a sign of an allergic reaction or an adverse reaction to large amounts of iodine. Okay? Now, any of these can be given as part of a therapy, or these may be given to prepare the patient for thyroid surgery. Okay? Number two, maybe the medications aren't working, so let's try something else. Well, that something else can be radioactive iodine therapy. Now in this case, you're trying again to bring the T3 and T4 levels down. But in this scenario, you're kind of destroying the thyroid gland, for lack of a better term. Okay, and again, the hope is to bring T3 and T4 down. So you can give radioactive iodine therapy. Now, one thing that you're always concerned with is, well, is this patient radioactive? And the answer is, well, the amount of radiation therapy that is given to these patients is not a large amount, so no radiation safety precautions are needed. Okay? Now, if they're getting this radioactive iodine therapy, the patient may complain of some dryness of the mouth, so you want to tell them to drink plenty of water, chew on some ice chips, and again, this is to prevent a dry mouth. Number 3, thyroid surgery or a thyroidectomy, or maybe a subtotal thyroidectomy. In a subtotal thyroidectomy, about 90% of the thyroid gland is removed. Okay, so number 3 would be thyroid surgery. Now, something very, very important that you must know for patients that have had a thyroidectomy, this is for post-op patients, you always want to assess their airway for any type of airway obstruction. Okay, make sure you assess their O2 sats, and you assess that frequently, at least every 2 hours, if not more often than that. But you always want to assess that that airway is open, because you always run the potential for an airway obstruction with a thyroid surgery. And for that reason, you also want to make sure that you always have suction equipment and a tracheostomy tray in the room. Okay, make sure you know that for the NCLEX exam. You must have suction equipment and a tracheostomy tray in the room available at all times. Now, with these patients, the patients that have some type of thyroid surgery, whether it is subtotal or a complete thyroid gland removal, you always want to place these patients in a semi-Fowler's position. Okay, so if you see that on the NCLEX exam, would you put this patient in a prone position, in a supine position, in a sideline position, or in a semi-Fowler's position? You know now that you would place these patients in a semi-Fowler's position. And you also want to be very, very careful. You also always want to assess the suture lines. You want to make sure that you're providing good neck support. You don't want that patient to overextend the neck. You don't want them to overflex either, because again, you're taking care of those sutures. You don't want those sutures to tear, to open. Okay, so make sure you always assess the suture lines. And if they've had a thyroidectomy, you also want to assess the patient for tetany. Okay, so you want to always ask your patient, do you feel any tingling? Is there any tingling in your toes, in your fingers, the mouth? Is there any muscular twitching? Assess your patient. Is there any twitching in their body? Okay, make sure you always assess for tetany. Now, for these patients, you always want to make sure they are on a high calorie, high protein, and high carb diet. Again, these guys are just constantly moving around. They're constantly burning up fuel, burning up energy. Therefore, you want to have them, again, have a high calorie meal, high protein meal, high carb meal. You want to provide the nutrients that they require. And sometimes you may even give them 6 full meals a day. Okay? Now you want these patients to avoid high fiber foods. We already talked about how they're going to have increased gastric motility. So if you give them high fiber meals, their GI tract is going to get rid of that food at an even faster rate, so more diarrhea. So again, you want to avoid high fiber foods, high spicy foods. You also want to tell them to avoid caffeine products, chocolate, soda, again, anything with caffeine, because these guys are already restless, they're agitated. You don't want that to increase even more. So again, you're going to avoid caffeine products. You're going to replenish fluids. We talked about this earlier, so you're going to do some IV fluids. And again, this will be up to the physician. You want to replace those IV fluids, or excuse me, those fluids that have been lost through diarrhea, through sweating. Again, you're going to replace fluids by way of IV. You're going to put them in a calm, quiet room and make sure that room is cool to temperature. Again, these run the risk of heat intolerance, so you want to provide calm, quiet, and cool room. If they're suffering from exothalamus, again, you want to provide adequate eye care. You want to provide artificial tears. Apply artificial you're going to apply artificial tears. Oh, I'm messing that one up, but again, you're going to apply artificial tears because you want to prevent eye irritation. You want to prevent eye dryness. Okay, this is for the patients that are suffering from exothalamus, and for these patients, you also want to elevate the head of the bed. You want to make sure they sit upright always to decrease the amount of pressure, to decrease the amount of periorbital pressure. You want to decrease the inflammation. Okay.